Massachusetts set yet another grim record this week, surpassing 20,000 COVID deaths and hitting yet another new case record. Again, confirmed new cases per day in the state have nearly tripled in just 2 weeks. And again, there's far more demand for official tests than there is availability. So while the good news is the Omicron variant is clearly less severe, the bad news is that it spread so much more quickly that hospitalizations are at near record highs and hospital staffing is around record lows because so many of them are getting infected. And then there's the school situation.
In-person learning is better for our kids, right? As a mom with 2 kids in our school system, I know that to be true.
But that's getting harder and harder to make happen with massive teacher shortages, constant uncertainty, and kids and parents fearful and confused. Didn't we see this coming? I'm pretty sure public officials were telling us before the holidays that this was going to be an issue. Though after nearly 2 years of COVID, pandemic fatigue has set in for many, and those warnings just aren't inspiring the same kind of action they used to. How can we get the message across? Joining me are Dr. Cassandra Pierre, Medical Director of Public Health Programs at Boston Medical Center, and Dr. Bisola Ojikutu, the head of Mayor Wu's COVID-19 Advisory Committee. Welcome to both of you. Dr. Pierre, I want to start with you. We've talked a lot over this pandemic, and I had the situation where folks who I had been warning personally in November that, it's possible it's going to get bad. And then when we got the news over Thanksgiving about Omicron, and then they got sick and they were like, well, how did you know this? What do we need to do to help communicate to folks when there's news and what they could potentially be doing to diminish their opportunity of getting infected?
I think that's a great question, and I think we're still trying to figure that out. I think it's clear that transparency about what we've been seeing, even in our own hospital staff, I find that talking about what we're seeing in our actual hospital, what the risks are, where the risk lay in terms of sources of infection, are really helpful in terms of galvanizing people to do what we want them to do, both in the hospital and outside. Part of that also comes in with making sure you have a trusted advisor, a trusted voice who's bringing and delivering that information. But I think the thing that really concerns me is that many people are not necessarily tuning into mainstream sources of information. They're getting it filtered through family and friends and through social media. And so I think there's a lot more to be done in terms of kind of breaching those frontiers and sending out helpful and actionable information.
Dr. Ojikutu, I'm not a math major, but I was able to pretty easily figure out that if there was a variant that was going to be much more transmissible and that more people were going to get it, even if many of them were not going to get very sick, just the math of it was going to mean that it was going to be more transmissible to vulnerable populations, to the unvaccinated, and to those who, for medical reasons, can't get vaccinated. How are we doing communicating that from a government level to folks that need to get this information?
Well, again, I think that you're highlighting a major concern that's not just related to the Omicron variants. I mean, health communication has been complicated and challenging throughout the pandemic. As the executive director of the Boston Public Health Commission, health communication has been a very high priority. We've spent a lot of time talking about vaccination and boosters and the need for our populations to be boosted. Here in Boston, we only have a booster rate of about 38%. So we're still working on it. And I think that it has been an effort that's taken a lot of time and work with our community partners, because you have very vulnerable populations who are not necessarily aware of or who have access to mainstream media per se. In addition, we're trying to keep our messages very clear and very simple. We need everybody to wear well-fitted masks indoors. We need to limit the size of our gatherings. We need to be using rapid testing as a prevention strategy or as a mitigation strategy. Other things like simply washing your hands frequently, continuing to physical distance. These are things that we've been very clear about. And I think that part of the problem here is that people are tired. This has been a long pandemic. It's been 2 years of dealing with COVID-19. So it's become even more difficult to message and for people to adhere to the guidelines and the prevention strategies that we discuss.
Dr. Pierre, I want want to build off those points too, because those are all my next questions to the same degree. We're all tired and we're all confused because I imagine for the both of you, I know it's more than a full-time job to keep up on this, and you've actually had the education and the experience and the expertise to be able to understand what's happening. But for many of us, it's really hard to keep track. The messaging about the masks, which is evolving as the disease, as the virus evolves, now we should be getting better masks. And last year it was, look, at any mask is better than no mask. Well, now we need better masks. What can people do? Do you have a recommendation of a way to make a habit, a regularity, something good, like every day to check in at some news site or some public health site in order to try and get the most updated information on helping to prevent transmission?
Yeah, I think that's hard to do as well because there is so much going on. There's a lot of information and it might be difficult to know what to identify. I would say definitely I, have my alarm on. New York Times has throughout the pandemic been a wonderful site and source of information and updates and really clearly accessible and readable charts in terms of trends of vaccination, trends of infection, and what the recommendations regarding vaccine updates and new variants have been. So I think that would be, for people who have access to it, would be a good source. I would say that there's a lot of great communication coming up. I'm sorry, I don't mean to pander, but from BPHC and the Department of Public Health as well, and the CDC, of course. But, as we talk about many, and has been said, many people are not necessarily accessing or have access to those mainstream news sites. So I know in my own personal life, many of my friends call me, but not everyone has access to an infectious disease doctor or a commissioner of public health to contact. So I think that we need to search for improving the access. I would say that there's a lot of great news media available that I tune into every day, and many of the people in the audience do as well. But I think we're struggling to reach the people who are not necessarily tuning into this channel or to those news sites.
I want to ask you, Dr. Ojikutu, about some of the things that I hear, and actually you too, Dr. Pierre, if you can give me what your answers to them are, okay? So I'm hearing from friends and family, well, we're all going to get it. We might be now at this phase where we're all going to get it. Dr. Ojikutu, what would you say to people in your family if they said that to you?
Well, I would say first and foremost that there are a lot of unknowns about the Omicron variant. We know that it's highly transmissible, but we also know that infection is preventable. We know that vaccination and boosters do provide some protection against transmission. And masking, well-fitted masks, higher quality masks do provide protection against infection. I think these are important strategies. The other thing is protecting other people around you, particularly the most vulnerable people. And if we as a community are doing things like doing rapid antigen testing, if you have access and it's available to you prior to events, then you're protecting those people who are at those events. So I wouldn't give in and say, oh, we're all going to be infected. I would say that we should implement the mitigation strategies that we know are evidence-based and do them on a regular basis. And I think that many people will not be infected necessarily with this variant or any other.
How about this one, Dr. Pierre? I'd rather get it now than get it later because I've got plans coming up. And if I get it now, then I won't get sick again because I'll have more immunity.
Yeah, so I would agree that you should, even if you believe that this is an inevitability, we should not let this wash over us. I definitely disagree with getting it now versus later. Right now, we talk about the math as you did at the beginning of the segment. Even if it's experienced as a milder disease, particularly for those who are vaccinated, more cases means more opportunities for more severe disease, hospitalizations, and deaths. So in a crowded, overtaxed healthcare system where it might be difficult to even access tests, maybe difficult to access treatment, this is not the time to get sick. We should extend as much as we possibly can the opportunities to get the disease by doing the things that we know will help. What I would also say, though, to people who say this is, even as much as we need to continue to wearing our masks, physically distancing, getting our boosters to reduce the risk of infection, I also do tell people that just from a logistic perspective, it's good to know that you have a plan in place, especially with kids in school, for what to do if you have symptoms. So I think that's a really important piece too.
So I grew up, my mother was almost like a storm doomsday planner. We always had extra cans, we always had candles, we always had batteries, and I don't know if it's genetic or just wore off on me. I went and bought, the N95 masks early, and stored them and kept them, and started wearing them in November. Every time I saw tests, I bought them. And folks in my life have started calling me Santa COVID because I come around with the tests and I come around with the masks and hand them out. And I'm just wondering, this is obviously with us and going to be with us for a while. Can we start developing more people like me and other people's families? I mean, Dr. Ojikutu, do you have messages to people who are like us? I don't have a degree by any means in medicine, but I certainly know how to plan for an emergency. Is maybe this a good idea of trying to get community leaders, neighborhood leaders, kind of like ward bosses in the old days, to be in charge of keeping communities safer?
Well, I think that being a person like you is a great thing. I mean, you're the type of person, right? I think this is the type of person we need out there, particularly in times like these when people are tired. People are going to keep people motivated and thinking about the mitigation and prevention strategies. We've already developed many community leaders who are leading the fight in regards to COVID-19, and they're out there, boots on the ground, knocking on doors, doing mobile activities. They were passing out our test kits. We passed out 180,000 test kits about 2 weeks ago throughout the city of Boston. They did a lot of that effort, and they were out there talking about wearing masks. They were giving out masks. So we have people out there who are doing this. They're spreading the word. The reason why we're at 69% fully vaccinated rate and 80% of our population has received one dose of vaccine is largely because of these community folks who are leading the way. So I would say that they're essential to this process, and the more people who are doing that, the better.
Dr. Pierre, can you talk a little bit? This isn't just a pandemic of people getting sick from COVID because of the challenges to our healthcare system. Many folks are not getting their usual vaccinations. Some people are putting off going to the doctors. Some things that you might want to get done, like even if you want to get an eye lift, you may not be able to get it done. Can you just talk quickly about how the pandemic is impacting that so that we can think about taking better steps to keep ourselves healthy?
No, it's actually very devastating. This is another component of the pandemic of the first wave I had hoped not to see again. Definitely people are foregoing or being rescheduled or delayed having treatment for conditions, more impactful perhaps than an eye lift. Right now we're seeing surgeries being rescheduled, maybe even some essential surgeries being rescheduled and delayed. Many places are experiencing that their outpatient services, the ones that we need to do our screening and preventive checks, to get our refills, those are also being delayed or rescheduled or turned into telemedicine visits. And luckily, we do have that option for those outpatient visits. But there's so many things where delaying that touch, that evaluation or the surgery can lead to bigger and more severe health consequences. We have seen in our hospitals in the past few months, more people presenting with more progressed malignancies, cancers, people coming in with new or worsened cases of diabetes. So many things that, while not directly, attributable to the virus, have been worsened by people's inability to get into healthcare. Yeah, so again, another reason not to get sick at this point.
I only mention the aesthetic because I'm trying to talk to people that may not think they're ever going to have a heart attack, but may actually want to get a nose job someday. So make sure that they're making sure that they're keeping themselves safe. Dr. Pierre, Dr. Ojikutu, I so appreciate both of your efforts and all that you're doing to try and keep us safe and healthy as we get into this new year. Thank you so much for your expertise, and thank you for joining us.
Great to be here.
Thank you for having me.